Hey everybody, thanks for tuning in. I want to talk today about dry eye testing and one test in particular. In my practice, we measure lots of parameters like I'm sure you do. We screen with a speed test. We use Zone Quick to measure tear volume. We can measure meibography. We can measure non-invasive tear film breakup time. We can also look at lissamine green staining and fluorescein staining. And we can take a history in general looking for dry eye. One tool that I like to be part of this is the InflammaDry, which measures MMP9s. This is a test by RPS. It's a point of care test where you can take a tear sample and get results within about 10 minutes, letting you know whether or not there's a high amount of MMP9s in the tear film. MMP9s are a non-specific biomarker. And what the InflammaDry is measuring is 40 nanograms per milliliter. So this MMP9 is most closely associated with dry eye disease. It's a gelatinase, and it's present when you get epithelial cell distress and epithelial remodeling. Why I like this test in particular, inflammation is an important parameter to me. I know that inflammation is likely present in most types of dry eye, MGD and aqueous insufficiency. I know how to treat inflammation. I treat it with an anti-inflammatory. So if I get a patient who's measuring positive on MMP9s, I'm likely to go anti-inflammatory. If they're negative on MMP9s, I'm still going to look at the big picture and decide what to do, but I'm less likely to go anti-inflammatory. It's got a high sensitivity and specificity on some of the tests that have been done. It's one of the highest levels of sensitivity and specificity in dry eye testing. It helps to monitor treatment effectiveness. So if you start a patient on anti-inflammatory therapy and check them back in a month or so, expect that to be negative or reduced. Now, when you interpret this test, it can come out as sort of I grade it as a mild, moderate, or severe positive. It's important that you look very carefully because you can pick up a very mild positive. This would be early stage dry eye. If you get a patient that you get a high level of inflammation, or you start them on therapy and they come back a month later and they're still positive, one of the other bonuses about this test is that you can be thinking about systemic inflammation. So start thinking about rheumatoid arthritis or Sjogren's in particular. Ask them if they have joint pain or fatigue or excessive thirst. That's important. And there are some tests that can be done to evaluate that or refer them out to another doctor. There's no capital outlay required. So this is a test that you just pay per use essentially. It does have a code that you can submit. Some insurances are covering this right now. It's easy to do. Your staff can take this measurement within a matter of minutes. It's comfortable for the patients. When you learn how to do it correctly, it's not an uncomfortable test. And it drives compliance. So if you have a patient who's, say they're kind of borderline on their OSDI or their speed survey, or they're not really screaming, I have dry eye, but you suspect it and you find it. If you have a positive test result, patients are much more likely to comply with you when you put them on the appropriate treatment plan. All this considered, again, it's not the test, it's a test. It's one parameter. I like it again because I think it's reliable and for all the reasons that I mentioned. But it is important that you don't let it become the decision maker. It's important that you still take a thorough history, look with the slit lamp, use your clinical judgment. I'm not saying that you shouldn't do that. You absolutely should. This is just another tool to help us. And I always think more information is better. I can't really look at a patient and say, I don't think doctors can look at patients and say, you know, your cholesterol looks high, your blood pressure looks high, your blood sugar looks high. They do tests to determine this. And now we can say you have inflammation or not. So I think denying that information really isn't the best way to go. But again, look at the big picture and make the decision for yourself.